What's up, guys? It's July 2, 2025. It's been like 2 weeks now, a little bit more than 2 weeks since I've started internal medicine residency. I'm on day 10 on my inpatient internal medicine service, and it's also been 3 months since I've had my thyroid surgery, total thyroidectomy. And so I want to make this video as an update on my thyroid cancer. And also, I want to talk about what it's like being in the first couple weeks of internal medicine residency. So, I'll start by talking about the internal medicine residency and then move on to talking about the post-thyroidectomy life. I'm just trying to figure out the light here. I think that's good. So, yeah, um, I'll start by talking about the cons, what I don't like about being an internal medicine resident. So I'll start with the bad stuff first. Then I'll talk about the good stuff, and then I'll answer the question. This is my second week of working in residency. Um, do I regret, going into internal medicine? Um, I want to talk about that a little bit. And I want to be 100% perfectly honest because, there's no point making these videos if I'm not going to be honest. There's no point in watching these videos if I'm not going to be honest. And then I want to update people who've been following me on my thyroid cancer as well. So, first of all, starting with the cons, what I don't like about being an internal medicine residency is the hours. I mean, the hours are absolutely terrible. So right now I'm on wards, which means I work on the inpatient service. Right now it's 8:40 p.m. I have to wake up at 4:30 a.m. tomorrow morning, which means if I want 8 hours of sleep, it's already too late. And I got home at 7 p.m. today. And I have to wake up at 4:30 because I have to get to the hospital by 5 a.m. And I have to get to the hospital by 5 a.m. because I need to go see all of my patients. I have 6 patients. I need to read up on them, see what their vital signs are see what their vital signs are, see what their lab values are, see what their ins and outs are, see if there's any new notes dropped by, other specialties, for all of these like 5 or 6 patients, see if there's any new diagnostic results, whether those are blood cultures, whether those are, imaging results, whether that's, surgical pathology. Uh, and if a new patient was admitted overnight by the night team, then I got to read up on that new patient as well if they were assigned to me and be ready to pre-round on them and round on them and so on and so forth. And I got to get my notes ready as well because I want to write as much of my note as possible in the morning before because I'm gonna be working the whole day. And so just talking about the hours, let me go over what a typical day looks like. You get there at 5, you pre-run on all your patients. I mean, you pre-chart on all of your patients, then you pre-round on all of your patients, which means you go and see all of your patients. And then around 7 a.m., and believe it or not, it does take 2 hours, at least 2 hours to do all of this stuff, at least for me. It's a first week intern, second week intern now. Around 7:15, I talked to my senior and we go over the plan. She says, "So what do you plan on doing for this patient, this patient, this patient, this patient?" And then around 8 p.m., uh, there's 2 interns on my team and one senior resident. And anyways, so uh, around it, it takes a while to get through that process as well. And around 8 p.m. is when we have rounding. So the attending physician comes along and the whole team walks around with the attending physician, seeing every single patient, talking about every single patient, making a plan for every single patient. This takes like 3 hours. If we're lucky, we can get it done in like 2 hours, but usually it takes 3 hours, maybe even 4 hours. Um, After rounding, Usually we might have like, if we're lucky, we'll have like 30 minutes to write our notes because we have to write these long notes on every single patient. And if we're not lucky, then it's already 12 p.m., which means, or 11:30 p.m., which means it's time for morning report, 11:30 to 12, which is like a teaching session. And then noon conference, 12 p.m. to 1 p.m., which is when we get free food, thank God, and we watch a lecture. And then after at 1 p.m., if there's a new patient on the service, which there usually is, then I need to go see that new patient, and then I need to devise a plan for that new patient, and then I need to write a note for that new patient, and then I need to go back and make sure I've written the notes for all of my other 5 to 6 patients from the morning, and I need to make sure all of my orders are in from the morning. In fact, the orders come first, then the notes. And then I need to make sure there's no updates on all these patients, and if there are, I need to make sure I write them down because by 4 p.m., then I have to run the list with the attending physician. And run the list basically means rounds, but sitting down, where me and the intern and the senior resident and attending physician will sit at a table and we'll go over every single patient. And so that'll take like 30 minutes to 1 hour. Um, and then after that, 5 to 6 p.m., if I'm very lucky, if I've been efficient for the day, um, after soon after 5 p.m. I can leave. But if I'm unlucky, then from 5 to 6 p.m. I'm writing more notes. And then at 6 p.m. there's handoff. So we tell the night team, such and such happened with such and such person. You should expect such and such. Um, during the night, be careful about this. If this person has atrial fibrillation, then if their blood pressure goes up, then make sure you give them a metoprolol. If their heart rate goes up, not blood pressure, if their heart rate goes above 140, then you can give them metoprolol. This person has anemia, they've lost blood a few times, they've needed transfusions a few times, so just keep your eye out for that. Things like that. Oh, this person's sodium is low. Anyway, so then we do sign out like that. We talk to the night team person. And anyway, so then by like 6:30 is when I leave the hospital and I get home around like 7. Um, you know, and then I gotta sleep at 8 if I want to get 8 hours of sleep, right? So I can do it all again on the next day. So, the number one con right now is the hours, the work schedule. I feel like I have no life. I mean, I really don't. Like, it's just, go there, come home, sleep. So, that's the number one con. And the thing is, I'm not complaining about my program, just to be perfectly clear. I'm complaining about internal medicine residency and residency in general because my program is actually benign. Because these hours, while they suck, once I get into the outpatient setting, ambulatory setting, and once I start doing my subspecialty rotations, they'll be better. And in my residency, the way it's set up is I do 3 weeks of wards. So that's what I'm on right now, wards or inpatient service. Then next I'll do 3 weeks of ambulatory outpatient. Then I'll do 3 weeks of cardiology. Then I'll do 3 weeks of neurology. Then I'll be back on the wards. And so every 3 weeks I have a new rotation. So with my program, my schedule is actually not that bad compared to say, I don't know, other programs where you spend like, I don't know, like 6 weeks on wards and then 1 week off or 2 weeks off. Like Lakeland, Florida, they during the interview season, they were really selling themselves pretty hard. Um, you'll never be in the hospital past 7 p.m., stupid stuff that's should be for granted. And anyways, they have a 6+1 schedule over there or 6+2, I think. Either way, those people are worked even worse than, me. So even though my program is benign, the schedule sucks. And the other thing is for night owls, the schedule is terrible. So, I'm a night owl. I find that I I stay awake. My brain works better at night. So like even though I'm sleep deprived, I don't feel like sleeping right now at night. But I'll tell you when I'll feel like sleeping is tomorrow morning on rounds when I'm standing for 2 hours and my co-intern is presenting and she's awesome. I'm not saying anything against her, but when I'm trying to listen to my co-intern present about a patient I'm not following, that's when I'm gonna be like, is falling asleep, you know. And so medicine in general, medical school, pre-med, you name it, for us night owls, it's just not made for us. Um, Another con is that I feel dumb pretty much every single day. Like, because I just don't have time to read up on it. I have 5 to 6 patients with different things, and I'll read up the basic plans for these things. But I definitely don't feel like I'm learning enough to be an expert on anything. Like, one of my patients has atrial fibrillation with RVR, and also heart failure, and also pulmonary hypertension. I mean, these are three huge topics I could spend a while learning about. But like, you know, once I come home, I'm not gonna, once I come home, I do some Anki cards for step 3 and then I go to sleep. And I also need to eat my dinner, and I also need to take a shit. So, I really don't have time to like actually read up about this stuff. So, I see all these different pathologies, but I really don't understand them as much as I would like to. Um, which my understanding is eventually when I'm more efficient, I've taken step 3 and I'm only studying for the mixed step, then I'll have more time to really delve deeper into these things. But regardless, I am learning a lot, just not as much as I would like to, and I feel dumb every single day. I mean, it's just because I don't know everything about everything, you know what I mean? And anyways, a lot to learn, big learning curve, and I'm at the bottom of it. Um, and it's not just like that kind of stuff, like, oh, how do you treat AFib with RVR, or what is the goal-directed medical therapy for heart failure, or what is Mollaret's meningitis, or you name it. It's not just that. It's also just like basic stuff like charting on Epic, putting in orders into Epic. Uh, Sorry, not Epic. We don't use Epic here. We use a different thing called Cerner, which I'm not used to. I'm learning. Um, and the thing is, like, I'm asking my senior resident so many questions, and I don't always want to ask her questions, right? Because she's busy too. But then when I don't ask her questions, I do something stupid, like I put the wrong type of order in, or I put the wrong dose in. And anyways, thank God for pharmacists for saving lives, for seeing my orders and stopping them. Um, but so there's this big like learning curve, and there's just this awkwardness where I know I have so much to learn, and I'm just bothering the senior resident on a constant basis. How do I do this? How do I do that? And the senior resident themselves is like so stressed. So there's that too. Um, the other con is more of a personal thing. Uh, I miss living at home. I mean, I'm basically living alone for the first time in my life, at 27 years old, and there's some good things about it. There's no distractions. I come home and I study without having to, talk to anybody. Zero distractions, Um, but it's nice to come home and have, dinner made already, and not have to do the laundry, not have to, wash, spoons and forks and stuff, and not have to go get groceries every now and then, and just being around my family. Uh, I miss that, you know, and I really do. Uh, and then the last con is money. So you know, I'm $200,000 in debt, and the salary here is 65,000 a year. It's nothing, especially because that debt has interest on it. Um, but now moving into the pros of internal medicine residency, the money, right? At least I'm making some money. So I'm still doing my best not to spend that money. Luckily, another pro of internal medicine residency, free food all over the place. Um, and so usually I'll during lunchtime when they give that free food, I'll just eat a shitload of food. And then when I come home, I'll probably just eat some like cereal or something. Or I might even steal some food from our fridge over there. By steal, I don't mean actually steal. I mean like leftover food from the noon conference. Don't get me wrong here. Yeah, I'm not an asshole. At least not in that sense. But yeah, there's like snacks all over the place, Oreos, um, chips, you name it, and that's always great. Um, so the other pro is, the reason I went into internal medicine residency was because I as much as tired as I am, as much as I don't want this to become my life, um, and what I mean by that, I don't want this to be every moment of my life, which is what it is right now. I still do enjoy learning, and I am learning a lot every day. So, yes, I have one patient with like three different weird diagnoses, which I don't completely 100% understand. But like, for example, I had another patient last week, Kevin, with altered mental status, confusion. And this patient's urinalysis. And so when we think about altered mental status, we think about why are they confused? Is it because of their metabolites? Is it because their sodium is too up or too low, or their uremia, or are their kidneys not working right? Or is it another cause? Is it intoxication? Is it alcohol? Is it drugs? Is it trauma? Do they have a stroke? Hemorrhagic stroke, ischemic stroke, um, a bunch of other stuff. Is it a viral infection? Is it any kind of infection? Is it a meningitis or something like that? Is it an infection of the nervous system? And anyway, so we learned how to, even though I feel like there's way too much to learn, like working up that patient with altered mental status really helped me, for that one issue to broaden my differential diagnosis skills. Because, that patient had a normal urinalysis and a normal basic metabolic panel, and a normal, a CT had a normal CTA and normal imaging and normal echo. And so we're just thinking, what could be the cause? What could be the cause? What could be the cause? And eventually we found something, right? Um, so, I am learning a lot on some patients. On other patients, um, not so much. There's also some patients which they basically come to the hospital to die, which is just sad. It's like a daily depression walking into these patients' rooms, asking their loved ones, "How are you doing?" I mean, it's a stupid question. How are you doing? It's a stupid question. It's how do you think they're doing? I, and to be honest, I need to work on my own interview skills. Like, so anyways, I've had patients like that where they're basically just dying and they're on comfort care. I don't know what I'm doing. I'm not doing anything for them except, waking up their loved ones every morning and saying, do you have any questions or complaints? So there's patients like that where I'm not doing anything. So there's that too. So again, this is the pros section, but also mixing in some cons because I want to be real here. So happy to, again, lots of good learning. I wish there was more learning. Um, Another pro is internal medicine is a very flexible career. Like if I become a hospitalist, one of my best memories from childhood was every summer vacation for 1 month we would go to Turkey. Um, and that's kind of how I want to raise, my own children too, if I live here in the United States of America. I want to, go on vacation every month, maybe to Europe, maybe to somewhere else. Um, Vacation time is important for me and like prolonged vacation time. And, as a hospitalist, you can do that. It's probably the one career in medicine where you can probably take, if not month-long vacations, then at least like 2 to 4 week long vacations. Um, at least 2 week long vacations. And then if you try to trade and stuff like that, like 4 week long vacations. Um, and anyways, if you don't like hospitalist work, which I'm gonna be perfectly honest with you, there are days where I get to the hospital and I think I don't really like this job. you can do a fellowship. Um, and or you can be a PCP, a primary care doctor. So the flexibility within internal medicine is awesome. Um, and then the last thing, last pro is I'm doing internal medicine in a really beautiful place. And I'll make some vlogs outside later. But the place where I came when I first matched here, I was like not stoked about it. I was like, wow, this is really in the middle of nowhere, huh? But it's a really beautiful location, and the hospital is really nice, and everybody who works here is amazing. And I'm glad I matched here. They say you match where you're supposed to match, and this place was not very high on my rank list, but I'm really glad I matched here. And so, anyways, this brings me to the ultimate question. 1 week into residency, like 1.5 week, like this is my third week of residency. I did a week of wards, and so now I'm on the second week of wards. Um, how do I feel about it? Am I glad I chose internal medicine as a career? Um, and I'll just tell you guys, one of my friends from medical school, one of my colleagues, they did pathology. And so I was texting, my colleague, actually like yesterday, and he said, "Your schedule sucks, bro. I work 9 a.m. to 4 p.m. every single day as a first year resident. Um, of course, they have to study at home and stuff. And honestly, that schedule doesn't sound that bad. Because like yesterday morning, actually this morning, like 4 a.m. this morning, right now it's 9 p.m. I'm gonna go to sleep soon, but um, anyways, I was pissed off this morning. I was fucking pissed off because I did eight days straight of wards of working. I had 1 day off, just 1 day off, and then I was back in the freaking hospital. And so I was pissed off. I was really thinking, is medicine the career for me? Why the hell did I do this? You know, which that was my mindset, 12 hours ago or however long ago that was, 60, however long ago that was. Um, and then I looked at, I was like, maybe I should have done pathology. But look, when I left the hospital at freaking 6:30 p.m., uh, believe it or not, despite being tired, I was happy because I felt like I had accomplished some things. I had learned some things. I had been useful in some ways, not necessarily in all of the ways that I want to be useful, because mostly I'm just writing notes and putting in orders and doing crap like that. But I was still useful, and eventually, I'll be more useful as my diagnostic skills get better. My brain will actually be useful as well. But anyways, I felt like I had accomplished something, and that's something which in medical school especially in the last year, I didn't often feel. Like I remember one of my last rotations was otolaryngology, and I was just pissed off for the whole rotation. I was just like, please just let me get the hell out of here, because I would be standing in some corner of an OR, watching some surgery, not doing shit, or being a note monkey for a clinic, you know, and just waiting to get the hell out of there. But now, despite the hours being absolute shit, I feel satisfied. Um, so again, would I choose internal medicine again? If you having pursued medicine, having pursued medicine, internal medicine was the right choice for me. And because I like seeing patients and I like thinking very broadly, and I like the idea of being a master of all trades. Now, maybe one day I'll be a specialist, but I like the idea of having a basic understanding, at least a basic understanding of all aspects of medicine, of how to handle, acute heart failure or acute osteomyelitis or, altered mental status, you name it. I think that's it. It's very cool. And if I wasn't so tired every single day, I would enjoy it even more. Um, so I don't regret internal medicine residency. there are aspects of it which I strongly dislike though. So I'll just put it that way. But God willing, inshallah, I'll get better at this and the hours won't be as hard on me anymore. So that's how I feel about internal medicine residency right now. 1 week in, I keep saying 1 week, in my third week and my second week of service on words. And yeah. So anyways, now before I go to sleep, one last thing to end this video. I had my thyroid cancer surgery on April 3. You can see my post-op video on this channel. So it's been 3 months. My scar looks really good, I feel like. I mean, usually it's not even noticeable, like when I'm standing. Um, and then my levothyroxine dose, I've been taking 137 micrograms every single day except for Tuesday, because on Tuesdays I've been skipping my dose so I can have a little stash. Because you guys, I've talked about this a lot, like worst case scenario, if something happens where I can't get my medication for some time, I want to have some kind of stash. That because this idea of being dependent on this medication still makes me uncomfortable. Not as uncomfortable as it made me, a few months ago, but I still like the idea of having some kind of backup stash. But because of that reason, um my TSH levels were kind of high. And TSH is something that goes high when the T4 and T3 levels are low, which means I'm not taking enough hormone. So I have been hypothyroid for at least some time, and I guess you can notice I've gained some weight, some muscle, some good weight, but also, I've just gained some weight overall, and anyways, we adjusted my dose to 150 micrograms, and I'm gonna take that 150 micrograms, and I'm still gonna save a pill at least once a week, once every other week, just to have some kind of stash backup supply. Um, Something that's interesting is, even though I'm technically a doctor, I can't be prescribing medication to myself. In fact, I can't prescribe medicine to anybody who except my patients, who are specifically like on my panel or who I'm following um, in the wards on the service. So yeah, um, it's just annoying how I don't know. I can't just get a bunch of medication and stack up on it. I have to do these other things. Um, but I feel well, like symptomatically, I feel really good. Like, you know, uh, the other day, so, before like 1 year before this whole thyroid cancer thing, I was able to run like a whole mile on like 7.8 speed on the treadmill. Now I'm up to like zero point 0.7 miles. So I got work to do, but, um, you know, I'm getting there. I just gotta train some more. Uh, because like right before the surgery, when I was in this hyperthyroid state, um, I could barely run like a third of a mile without running, getting out of breath because my heartbeat was like, super, like high. Um, so slowly but surely, I'm getting to a more healthy place. And also, I just don't have the time to be that unhealthy because I'm walking around the hospital 24/7. Um, yeah. So, I'm doing fine post thyroidectomy. Happy to answer any questions about that as well. Yeah. So, all right. Uh, hope you guys have a good one. If you have any questions about internal medicine residency, let me know. If you're starting for step 2 or step 1, good luck. We can do this. This is the road we chose, Biz bu yola baş koyduk kardeş. This is our road. So, let's keep grinding, keep working hard, okay? All right. Have a good one.